Hi, my name's Oliver Bailey. I'm a consultant trauma and orthopaedic surgeon and clinical lead of the acute knee service. I developed this service about 4 years ago with patient care at the centre. It's a pathway-driven service with the aim to see patients, diagnose patients and treat patients as quickly as possible through an MDT format. We have three core principles in the acute knee service, the first being improving patient care and clinical outcomes, the second being to increase our exposure and involvement in research and audit, and the third being to disseminate our knowledge and improve education and training on knee injuries and knee-related deformities and disease. To achieve these aims, we aim for an MDT approach. We have three acute knee surgeons, myself, Mr. Bhattacharya and Mr. Hopper. Got excellent knee-specific physios and ESPs. Got MRI availability within 24 and 48 hours, MSK radiologists, and excellent administrative support and management via Kirsty Mitchell and Marissa Maiden. It really is a one-stop shop for knee injuries, and I'm really proud of the entire team in the way they've helped deliver and develop the service over time. We work really well together to provide this regional service for NHS Lanarkshire patients. It really is the envy of other health boards around Scotland.
So I'm a consultant orthopaedic knee surgeon working here in NHS Lanarkshire. So research and education are two of the key pillars for us in the service, and this is not only important for the patient outcomes but also important for knowledge across knee surgery both nationally and internationally, and we want to contribute to the knowledge within knee surgery around the world. Key parts of that is research, and one of the key pillars, and research itself has different aspects of it. We are involved in various randomized controlled trials which are driven by the National Institute of Health Research, or NIHR, which is coordinated nationally from England. These are trials within the UK but also has international centres involved. Currently within our acute knee service we are involved in 3 international trials. One is called the Meteor 2, which is looking at meniscal allograft transplantation for meniscal deficiency. This trial involves various centres within the UK but also centres within Australia, Belgium and Canada. We are one of the leading centres in Scotland looking at this, whereby we're randomising patients who have got a problem with their meniscus or meniscal deficiency into either getting a meniscal transplant or specialised physiotherapy. It's a very exciting time for us, not just within this centre, but also across UK and internationally, to look at what results this trial shows to help patients. And this is a very, very niche area, so we want to see in future how this helps patients. The other 2 NIHR-led clinical trials we're involved in are called the Motion, and the Report. The Motion is looking at high tibial osteotomy for patients who've got a worn-out knee, particularly on the inside of the knee or the medial compartment osteoarthritis, and we're looking at whether realigning their knee by doing an osteotomy, which is like breaking part of their shin bone and realigning it to alter where the forces go across the knee, to see whether this is beneficial for these patients. And the third one is the Report trial, which is looking at patients who've got an unstable kneecap, so patellofemoral dislocation. And if they have an unstable kneecap, whether we can help them by doing certain specific type of surgery, which will involve putting the kneecap back into position and doing some surgery to stabilize it, versus specialized physiotherapy. So these are the 3 main national level randomized big trials that we're involved in as part of our acute knee service. But this is not just the only bit of research that we do. We've got various other things we've set up, and one of the other things that we're looking at is doing clinical research within the department, and this is focused on patient outcomes. The importance of this is this allows us to monitor everything that we do, both non-operatively and operatively, and see the treatment that we're offering our patients, whether this leads to betterment of their outcomes. And we can also sub-analyze various aspects of this that contributes to data to the knee community internationally. So we're specifically focused, for example, on the ACL patients. So all our ACL reconstruction patients at the moment give us scores at various time points of their treatment, and we want to see therefore how beneficial this surgery is for them, and certain aspects of treatment how we can make it better. So we're leading on all of that as well.
My name is Graham Hopper. I'm a consultant orthopaedic knee surgeon here in NHS Lanarkshire, part of the fantastic acute knee service that we have here. So we're involved with several of the universities, pretty much all of the universities in the west of Scotland. First of all, the University of Glasgow. So we have SSC students coming from the medicine degree. We have third and fourth year students. We usually have 2 at a time. They come for 4 to 5 week blocks. They participate in projects. We get them involved with clinical teaching. They get to scrub in theatre. They get to do projects while they're here, and they help with the quality improvement side of things, which is a fantastic experience for them. We can get some of the registrars helping with their projects, which helps with getting publications and things. Some of them are also getting to present at international conferences and certainly local conferences as well. The other universities are the University of Strathclyde, so we have some students there in the biomechanics department, so they're starting to do some projects for us on that side of things, looking at return to sport and various anatomical projects as well. The University of the West of Scotland is our local university, so we've got some work going on with them, looking at ACL outcomes as well as ACL prevention work, so we're doing that with them. And finally, we've got the University, Glasgow Caledonian University. So we've got Nicola, one of our ESPs that works within the acute knee service. She's going to be doing a part-time master's degree soon. And that's going to be looking at patellofemoral instability, and that's going to be clinical outcomes that we're checking from the acute knee clinics, as well as collecting the ACL data as well. And all of these universities are hopefully going to be of access to registrars in the region where we can do projects and maybe even part-time degrees as well, or possibly taking time out of programme as some of us have done recently. So we're hoping to develop a sort of centre of excellence for knee surgery first of all, and then the orthopaedic department in general. So we're hoping to get university status for the orthopaedic department. We're running several trials, as Mr Bhattacharya suggested. A number of us have got honorary status with the universities, and hopefully that will come with the university status.
So I'm Marisa Madden. I'm one of the Lanarkshire Orthopaedic Acute Knee Secretaries. I've worked with the acute knee team since it started in 2019. And it's probably one of the best services that you could work for, definitely. Patients always feed back to us, so acute knee is very specialised, so we have access to MRI scans on the day that they come in to the department, which is brilliant because you could be waiting up to a year for an MRI scan. So the patient's full journey from start to finish with an acute knee is a lot better for the patient pathway, everything, and that always does feedback to us from the patients themselves. They say how smoothly it's been, whether they've come in and seen the consultants themselves, whether they've seen physios, straight the way through to their MRIs, right through to their surgery. The full team, the patients really feedback and say it's a great service that they've came through.